So I'm going to conduct a newborn assessment right now. So before I get started, I'm going to conduct it in a warm environment as much as possible. I'm going to try to use a soft voice. I have my PPE on, gloves. I'm going to verify it's the right patient, obviously with the bands. I'm going to try to warm my hands if I can, and my stethoscope as well. So the first part of the assessment, we're going to try to go from least intrusive to most intrusive. So I'm going to go ahead with the length. So I'm going to measure the baby from the heels to the end of the head. I'm going to take off this cap. So I'm going to measure that. And then I'm going to measure the head circumference at the highest point or longest point. And that head circumference should be 32 to 37 centimeters. And then I'm going to measure the chest circumference. That measurement should be 2 to 3 centimeters less than the head circumference. After that, I'm just going to look at general posture. So is the baby able to flex extremities? Are they stiff as a board? Are they straight? Or is there some flexion in the upper and lower extremities, which would be a good indication. I'm going to go to heart sounds. So I'm going to listen at the point of maximal impulse, which is the fourth intercostal space. I'm going to listen to one for 1 minute. Listen for murmurs or anything abnormal that I might be able to pick up. And then normal fetal heart rate is 110 to 160. After that, I'm going to do a quick breath assessment, breathing assessment. So I'm going to listen. Normal respiratory rate is between 30 and 60 in this population. And best place to listen is kind of near their armpits, just because they are so small. And obviously, lung sounds are just like the adult population. We're listen for the same adventitious lung sounds that could be present in newborns. And now I'm going to go just kind of from head to toe now. We got knocked out the kind of two major systems first. So I'm going to start with the head. I'm going to stand up for this. So I'm going to palpate along the suture lines here. You should feel both the anterior and posterior fontanelles at this point. This should be soft, flat, and firm. And then it wouldn't be abnormal to notice caput or cephalorhematomas. Next, I'm gonna look at the eyes. I'm gonna assess just the structure, and then I'm gonna assess function by looking for pupillar response in each eye. Great. Moving on down, looking at the ears, I'm going to make sure that they're equal bilaterally, and then that they align with the outside of the eye here. So if I was to put a straight line, that they would match up. Moving down to the nose, again, I'm just going to check for symmetry. At this point, you can see if they're patent by putting a finger in there, and then assessing if the baby can breathe with the other nostril. While doing this, you can put your other finger in the mouth, just so you're actually assessing each nair rather than they could breathe from their mouth. So you can do that for each nair. And then that's also assessing the rooting reflex or the sucking reflex as well. So mouth, this kind of ties into what we just did. So while you're assessing nairs, you can also kind of manually examine the mouth, both the soft palate, or the upper and lower palate, and then obviously cleft lip would be pretty obvious at this point, making sure that there isn't anything abnormal. And you can also assess for the strength and coordination of the sucking reflex when your finger is in the patient's mouth. So then after that, you can look at the lips and mucous membranes. They should be pink and moist. Again, you can, when your finger's not in their mouth, you can try to look at your patient's mouth, kind of the back exterior, see if there's anything abnormal. Next, we're gonna palpate the neck. Any swollen lymph glands or masses. You could turn the head from side to side, checking for range of motion. You can examine clavicles and breast development at this point. Normal is 5 to 10 millimeters of areola for both males and females. Moving on down, the umbilical cord. Green is normal. And obviously we could check for 2 arteries and 1 vein. And since I'm down here, I can do my abdominal assessment. So then I would auscultate all 4 lung sounds, or all 4 valve sounds. And then I would start with light palpation in the upper right quadrant, moving from upper right to upper left, down to lower left to lower right, and then harder palpation after that.
I have labs starting here in just a couple minutes.
Okay.
Okay.
Thanks. For genitalia, depending if it's male or female, I would, let's just say this patient is male, I would assess the rugae, the penis, and then making sure the testes have descended. That's major in this population too. So you can also assess anal patency as well. For hips, you can do the Barlow and orthogonally test. So Barlow would be bringing these hips down and then bring them out as well, and that kind of assesses for hip dysplasia. So now I'm going to lay the baby prone. Look for the symmetry. Look for any spina bifida. You can also look for symmetry of the gluteal folds as well. That can indicate HD as well. Moving on to reflexes. So we already checked the rooting reflex. You can do the palmar grasp, so just put your finger in there and they should grasp your finger. Plantar grasp, same idea. You can do the stepping reflex, so this is when you raise the baby and then when they make contact with the ground they should have an innate stepping reflex. Lastly, you can do the Moro reflex. This is the most invasive, so it's last. You want to just put the baby like this and slowly lower them, and then they should kind of splay out and then make a C with their hands. That's kind of the general overview of a newborn assessment.